Oftentimes, people experience adverse drug reaction as a result of a particular medication. According to the Adverse Drug Reaction National Database released in 2016 in Nigeria, over 2,000 cases were reported. This is a far cry from reality. Today on Sound Health, we will get first-hand information on how to manage and avoid adverse drug reactions. I'm Olasumbo Mudupe. Welcome to the show. How do you manage these conditions? Is it a condition or a disorder?
Is it a disorder? It's too complex to be a disorder, but I would say, because again,
is it a condition?
Adverse drug reaction, unless you're saying condition to the question before this time, the one of anti-malaria and all that, that could be a condition because we know specifically sulfur-based drug, but there's other drugs people react to. But I say the issue of how do you manage adverse drug reactions, right? Because again, I'm talking to the public. I'm not talking to doctors. If I'm talking to doctors and medical students, we'll go into management, care and treatment. But the first line of management is prevention. So I'm speaking to all of us. Prevention is the key to management because you can never really know. The issue of pharmacovigilance, that's drug safety monitoring, pharmacoepidemiology, study of drugs in humans, is a discipline. The way we study medicine is a complete discipline. So some people, that is what they wake up and sleep with every day. So we can't possibly know how to do everything. But as in the public, the first way I say again is prevention. And how do you prevent? You don't self-medicate. There is no place for self-medication. Something as simple as paracetamol. Some people do not know, and I guess soon, but maybe you don't know that simple as paracetamol has its own effects. There's a level you get to paracetamol and it goes to your liver begins to have a problem. Exactly. So do not self-medicate. That is the first line of managing it, preventing it. When the doctor prescribes and you think that this is happening, looks like what the other person had, please go back to your doctor and ask, should I do this or that? And for us healthcare providers, educate patients more. We often miss that when we take history and interact with patients, we often miss drug history or drug counseling. We just say, Sumbo, take paracetamol 2-3 times daily. Bye-bye, next patient. An extra time spent with you telling you, if you take this medication, these are the things you can experience, you may experience, yes. That tells you, this doctor told you that, because there are so many cases we've seen, particularly with this septrin issue, they observed it. We are a community-based kind of people, and everybody is everybody's neighbor. I could just go and tell my friend, look at what I do, and they say, my sister had it too, and this is what we did. We went to go and pour something, or you go and scratch. You get what I'm trying to say? And this person genuinely and innocently sought counsel from somebody else who could help or who they believe would know the right thing. So, from everybody's point of view, do not self-medicate. Talk to your healthcare provider. From healthcare provider's point of view, spend a little more time. Tell your clients about the medication you have given, how to take it, what they may expect. If this now goes beyond this, please, even in paracetamol advert, they'll say, after 2 days, consult your doctor. It's become a regular thing, but those very simple things are very important. Yes.
Okay, Nigerians report only a fraction of cases of adverse drug reaction. This is a far cry from reality. According to the national database for adverse drug reaction report released in 2016, over 2,000 cases were reported. What do you think can be done to improve the cases of underreporting, and how do you think this can be checked?
Underreporting of adverse drug reaction is a global phenomenon. But again, as a nation, there are things we can do from experience that would improve or that may improve our reporting. So I'll take it from the healthcare provider point of view, perspective, and the client, the consumer. From the healthcare provider point of view, we need to understand that it's an ethical obligation. You owe your patients the right to first counsel them or educate them on what not to do concerning the medication. Spend a little more time in educating them about the drugs they've given. Tell them if there is something uncomfortable about this drug, please come back and talk to your doctor. When you have done that part and there is a report or a concern, you document. Yes, we know the burden, patient-doctor ratio, but it's an ethical obligation. It's part of the service you're supposed to offer, because if we don't document, we would not know what happens to our own population with the drugs that we are giving. We can't keep functioning based on the data from other countries. That's one. So healthcare providers should understand that it is our responsibility, and there are no litigations. When you're asked to put down your name and your email, it's simply to get back to you. And from getting back to you, the NAFDAC, the National Pharmacovigilance Center, has platforms like or avenues like sending quarterly newsletters and all that. It's a form of education for you as well when you report. So you get on the database automatically and you get information on what to do. So then awareness, you have to continue awareness. Most times the trainings are done one-off. And pharmacovigilance, drug safety monitoring, reporting, there is a new discipline. So you need to continually train people and create the awareness. You understand? Then increasing funding. Most times the yellow forms are not even available, in all sincerity. A lot of people that report will probably have to make the photocopies themselves. So it could be downloaded. So I'm getting there actually. But to say that downloading, somebody will tell you they require data, it's quite complex. So it's only that person that is very interested that will do that. So to make it easier for people to report, it will be one good that these forms are available where they're supposed to be, so that there is no excuse again about I need to go and use my money to make photocopies and report. But I'm now moving to what NAFDAC themselves have done. These forms are available online. You go to the NAFDAC site, you see the ADR form, or it's called yellow form, or it's called the individual case safety report form, downloaded, and it's simple to fill. Within 5 minutes, it's filled. You understand? Now, to make it further better, there is a code. It's called PRASCO, Pharmacovigilance Rapid Alert System for Consumers, something like that. The code is 20543. It's an SMS toll-free code where you don't require a lot of English and grammar. Let's take, for instance, somebody took say Septrin and there's rash. All you need to do is Septrin, maybe 54-year-old female, Septrin, rash. When you send that to that, somebody contacts you to get more information or detail. So that's a very excellent thing that consumers, because all of us hearing me today, can do. 20543, toll free. You're not going to be charged sending that SMS. Or you need the simplest language or grammar you can use. Just say something and somebody contacts you to get more details. So this again would improve, reporting. And I think from NAFDAC as well, as much as possible, they do a lot. They do TV shows. I don't work for them, but I know that they do that. They do TV shows. They do send out newsletters. Even when there are issues, they contact what they call dead healthcare provider letters to tell people on any alert or safety concerns. So these things are, because if people are aware, they will now see the need to report. And I must say again, something good that has happened again in Nigeria recently, not so recently, but in the past few years, you see the scratch code on medicines, particularly anti-malarials and all that, called mobile authentication system or something like that. Yeah. So is again a very good step in the right direction. Yes, that if somebody does that and the thing you don't get the response, you know that you're not buying the right drug and all medication. And if all of us are aware that medicine, as simple as it is, could move from being medicine and being something harmful, you know, well, I think the awareness, if it's there and sound in our heads, we'll make extra steps to talk about it, and you know, and the record will be there to improve our health.
What are your final thoughts on managing adverse drug reaction as we round up this segment?
What are my final thoughts? First is there need to be increased funding, because funding is a concern. I wouldn't say the political will now, because they haven't understood the impact of adverse drug reaction on the burden. Somebody comes to treat malaria with, say, 5,000 naira, but has a reaction that may cost 20,000 naira to treat. So you have the economic burden, you understand? So if you understand that, there will be a lot more focus. There are a few experts or trained people in pharmacovigilance, drug safety monitoring. And when I mentioned about awareness creation before, you need continuous training. Most people that are trained are just one-off training and that's the end. But I need to, because they are not taught this in medical school, there is need for continuous awareness or creation, continuous medical education on this issue. Then there's been a concern, or rather a drive, to include it in medical education, university curriculum, and postgraduate training, because that way everybody understands there is a lot more time spent on training the right people, at least healthcare providers, who will trickle it down to their clients and all that. Yes, and for us not to self-medicate as a nation, if we try not to, I think we'll go a long way. And when you have concerns, please ask your healthcare provider. As much as they know, the ones that do not know, they know their colleagues who are experts in this, and we just have that collaboration. Everybody asks, what do you think about this? So I really think first is, let us not get used to a particular thing. Oh, I know how this drug works, because there may be a different manufacturer, there may be a different storage system, you understand? Then I think that will go a long way to help us.
Thank you so much, Doctor, for sharing your expertise with us on managing adverse drug reactions on sound health.
Thank you so much for having me.
All right, that has been Dr. Chioma Ejekam, a public health physician and a drug safety expert on managing adverse drug reactions. Sound Health continues with trending and home essentials. Please stay with us. That's Sound Health this week. Hope you've learned a few things on managing adverse drug reactions. For comments and inquiries, please share your thought with us on 0818-815-3695 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.